Good afternoon, good morning, and welcome to the webinar, The Impact of the Expanded Child Tax Credit on Families Raising Children with Disabilities. Thank you so much for attending. This webinar will be recorded. The recording and slides will also be available later this week. Please use the Q&A function to ask any questions that you have, and my colleagues will be tracking questions, and we look forward to answering as many as possible later in the webinar. At this time, I'd like to introduce today's presenters. My name is Allison Boffman. I'm a project director at the Catalyst Center at Boston University, and I'm joined today by Caroline Parker, program manager of the Catalyst Center at Boston University, Leah Hamilton of the Family Economic Policy Lab at Appalachian State University, and Laura Brugger of the Social Policy Institute at Washington University in St. Louis. I'll now pass things over to my colleague, Caroline.
Thanks, Allison. So our plan for today is to start off with some background on children with disabilities and some information on the expanded child tax credit. And then we will go into the methods and results of our recently published report. Before I get started, just a quick note on terminology. So we do have a variety of audiences here with us today, and I know we have some folks from state maternal and child health programs. And in that space, we often use the language of children with special health care needs. In this report and in this webinar, we will use the language of children with disabilities, but we use a very broad definition of disability that we will get into a bit more later that is inclusive of children with special health care needs. Next slide. So using this broad definition, nationally, 19.5% of children have a disability, which represents 14.1 million children. So we're talking about a fairly substantial portion of families here, and we know that these families have very unique experiences and needs that we should consider in the discourse around the child tax credit. And one of the reasons why the child tax credit is particularly important for families raising children with disabilities is that they're at higher risk for various forms of financial hardship. So these families are more likely to report difficulty paying for their child's medical bills, more likely to experience food and housing insecurity, and they report higher levels of unsecured debt that remain elevated throughout the lifespan. And prior research shows that these families face increased risk of this financial hardship through three primary pathways: higher healthcare costs, higher routine expenses, and loss of employment income. So families may encounter higher healthcare costs due to medications, procedures, treatment, or adaptive equipment that's not covered by insurance. They may also face out-of-pocket costs for services such as physical therapy that most private insurance policies have built-in coverage limits for. And those coverage limits may allow for adequate care for a child with an acute injury or an illness, but not necessarily for a child with an ongoing disability. And lastly, these families may face elevated co-payments and co-insurance just simply due to more frequent provider visits. And then the second pathway is higher routine expenses. So routine expenses such as housing, utilities, food, and childcare can often cost more for families caring for children with disabilities. And these expenses can include things like home modifications to make their home more accessible, increased electricity costs to keep equipment in operation, or special dietary supplements or specialized daycare. And then the last pathway is loss of employment income. So parents and guardians raising children with disabilities often cut back hours, take a leave of absence, or leave work entirely to care for their child, including taking them to medical appointments or caring for them during prolonged periods of absences from school. And a recent study estimated that lost earnings due to foregone family employment are $18,000 per year for each affected household. So again, these are very unique pathways to financial strain for families raising children with disabilities that make them an important part of the discussion around the CTC. So with that in mind, I will now pass it over to Leah to give some more context on the child tax credit.
Great, thanks so much. I know that many of you here have been actively working on the child tax credit, so this may be not new information for you, but just in case. So in 2021, the existing child tax credit was temporarily expanded as a part of COVID relief efforts. So for 6 months in 2021, it was expanded for families with children under 18 were eligible to receive up to $3,000 per child and $3,600 for younger children under the age of 6. It removed the income criterion for refundability, which essentially means that families with $0 income could receive the credit for the first time. Half of the credit, so half of that $3,000 or half of that $3,600 was paid out monthly between July 15th, 2021 and December 15th, 2021. And it was really designed to help families recover from the COVID-19 pandemic, but was also a really important promising step for a lot of people who've been looking at child benefits, universal child support policies in the US. So our team jumped on this opportunity to study sort of an unprecedented family support policy in the United States. We partnered with NORC Amerispeak at the University of Chicago to survey a nationally representative sample of more than 1,700 child tax credit recipients and a comparison group with did not have children in the home or whose children were ineligible for the credit. We surveyed folks just before the first payments landed, July 15th, 2021, and then again after the final payment in December 15th of 2021. So we have a larger report out on the impacts for families at large. Here in a minute, my colleague Laura will get into the impacts specifically for children with disabilities. But as a brief overview of what we found for the full sample of 1,700 families, we found that most families reported using the CTC on routine expenses, essential items for their children like clothes, shoes, food, emergency savings, and debt reduction. We saw significant improvements in food security and healthy eating among recipients compared to non-recipients. For those ineligible, we saw improved financial security, especially among low and moderate income families. We saw increases in emergency savings contributions, which is really significant since so many families do not have emergency savings, cannot cover a $400 emergency. We saw declines in credit card debt and declines in use of high cost financial services. So that would be like payday loans or auto loans or even selling blood plasma to make ends meet. And we saw significant relative declines in evictions. We also saw some really important things happening for non-white families. They were using the money on things like tutoring or extracurricular activities at higher rates than white families, which was a really important indication to us that that families were using this to close racial educational gaps. And at this point, I'll turn it over to my colleague, Laura, who will talk about the impact specifically to children with disabilities.
Thanks, Leah. So I'd like to start by just sharing a brief overview of our sample. And the first thing I'd like to explain was how we defined disability in our study. So we defined disability in our survey using 2 questions. We first asked if anyone in the household had a disability. And by disability, we mean a physical or mental impairment that includes an emotional or learning problem that can be medically identified. If they responded yes, we then asked if that person was an adult, a child, or both. And if they answered that either a child or a child and adult, then they were considered to be a household caring for a child with a disability in our study. And so you can see here that in our sample, about 15.5% of households were raising a child with a disability. In our sample, we saw that compared to households not raising children with disabilities, households raising a child with a disability had more children, they had lower rates of full-time employment, and overall lower income. So most of the findings that I'm going to talk about today focus on the second wave of the survey, where we examined the specific usages and perceptions of CTC recipients. But before we do that, I want to talk a little bit about some of our findings from the first wave, where we looked at various hardships that households were experiencing prior to the CTC payments. So the first thing that we found was that households with children with disabilities faced more hardship prior to the CTC. And so you can see that here. These specific hardships included difficulty making bill payments, inability to pay the full amount of utility bills, foregone medical care due to costs, eviction by landlord or bank, and difficulty affording child expenses. And so all of those outcomes that you see here are statistically significant. Additionally, we looked at a series of food insecurity measures, and we found that households caring for children with disabilities experienced greater food insecurity prior to the expanded CTC. And so these measures specifically included being worried that food would run out and not being able to afford to purchase more, reporting that the food they had did not last, the inability to afford balanced meals, and relying on a few low-cost foods to feed their families. And again, all of these outcomes are statistically significant. So given that we know that several studies have established that receipt of the CTC led to overall lowered food insecurity and economic hardships, it's likely that the CTC also helped families raising children with disabilities manage these risks in that similar way. And so encouragingly, we found that families raising children with disabilities were more likely to receive the CTC. In fact, 84.2% of those raising children with disabilities in our survey reported that they had received the CTC. So I'll go ahead and turn next to some of our Wave 2 findings where we asked families specifically how they use their payments. And so in the next series of slides on the right-hand side, we can see this represents the percentage of families who reported having used the CTC in a variety of ways. The significant findings here are in bold font. And then to the left of the graph includes in the italicized font, these are actual responses from CTC recipients to an open-ended question where we ask them to please tell us in your own words, how did the CTC impact your family? And all of the quotes that are included here are specifically from respondents who are caring for children with disabilities in their households. So the first thing that we found was that families raising children with disabilities were more likely to report using the CTC for a broad array of purposes, including routine expenses, essential items, more and better food, paying down debt, health expenses, or moving and improving their home. And so we see one of the greatest differences that we see is in terms of food expenditures. And so we see that households raising children with disabilities were about 14 to 15 percentage points more likely to use the CTC for those food-related costs. And one parent said, payments assisted my family in keeping their bellies full of food that otherwise would have not been available, as well as paying for electricity and heating bills. And if we also see that families raising children with disabilities were more likely to use the payments to pay down debt. Another parent said, I was able to pay off a personal loan in a total of 17 months instead of the loan term of 8 years. And then finally, we see some differences in terms of health expenses and moving or making home improvements. And another parent said that they had faced many unexpected expenses that affect their children directly, such as issues with their house that needed immediate attention, flooding, and our family vehicle breaking down beyond repair, and we needed to buy a new one. The CTC has made the car payments manageable, and we've not been as strapped for money as expected. So beyond specific usages, we asked a series of questions intended to gauge how families felt the CTC impacted their household in addition to how they reported using the payments. And so we asked respondents to report their level of agreement with statements such as, the CTC helped me support my family, helped afford utilities, and so on. And so the first thing that we see here is that families raising children with disabilities broadly reported greater impacts from the CTC. And so each of these categories that are highlighted in red were statistically significant. And so in particular, we see greater impacts reported for supporting family, affording utilities, affording housing costs, and affording tutoring. One parent said, it helped us more than I could have imagined. It helped us pay bills, pay for vehicle repairs, get my son's braces that he has needed for years. Another parent said that the CTC took some of the financial burden off. It allowed me to pay for my child to have things and do things that I otherwise could not afford as a single parent. So beyond comparisons between families with and without disabilities, we also wanted to look at some subgroup distinctions within families who are caring for children with disabilities. And so first we looked at differences between white and non-white families raising children with disabilities. Though ideally we would have liked to use a more nuanced definition for race and ethnicity, we opted for this binary measure due to sample size constraints. So our first finding that we see here, our first set of findings, we see that non-white families raising children with disabilities were more likely to use the CTC to pay down debt, for better food for their families, and for education costs such as starting and growing a college fund, sending their child to a different school, and paying for tutors for their child. And all of these findings here are statistically significant. One parent said, "It saved us completely. We're able to afford groceries and pay bills." Also of note on this slide, we see that white families raising children with disabilities were more likely to use the CTC for gifts and entertainment, and 0% of these families reported using it for tutors for their child compared to 19% of non-white families raising children with disabilities. We also looked at the impacts, and we found that non-white families raising children with disabilities were more likely to report CTC impacts on education and childcare. And so if you look over here, over to the far right, you see that the non-white families were more likely to use to report that the CTC impacted them and helped them afford childcare and afford tutoring. One parent said that I was able to pay my bills each month and save $300 each month towards my kids' college fund. And then we also wanted to look at income as a subgroup. And so we looked among families raising children with disabilities. We considered those who had income above $50,000 per year and those who had income of $50,000 per year or less. And we found that low-income families raising children with disabilities were more likely to use the CTC for routine expenses, for purchasing more food for their families, and spending time with their children. One parent said, "It helped our family tremendously as we're living day by day on a very low income." And finally, we also looked at the impacts by income as well. And we found that low-income families raising children with disabilities were more likely to report CTC impacts on essential expenses, education and childcare, and spending time with children. And again, those highlighted in red were statistically significant. So we see those who are in the $50,000 or less category were more likely to report that the CTC helped them support their family, afford utilities, afford housing, extracurriculars, and tutoring for their children. And one parent said, "Having that extra money guaranteed each month made it easier to budget and afford my bills." And so with that, I'll go ahead and turn it back to Allison to discuss the policy implications of these findings.
Thank you so much, Laura. And I want to thank our colleagues at the Social Policy Institute and at the Family Economic Policy Lab for being partners with us in this work and being open and sharing their data set with us. So as you can see, and as you've seen, the temporary expanded child tax credit was really a landmark event, and research on its impact has shown that it resulted in many positive outcomes for families in general, including immediate and substantial decreases in child poverty, material hardship, and food insecurity, as well as health benefits, such as fewer symptoms of depression and anxiety among low-income adults with children. And we've seen how children with disabilities comprise nearly 20% of children nationwide. And their families' experience with the expanded child tax credit is really important then, because we know, as Caroline spoke about, that these families are more likely to experience financial hardship at all income levels. And the data that this survey showed pre-CTC was consistent with general data about what those family financial hardships are, things like medical bills, food insecurity, and housing insecurity, and also debt that remains elevated throughout the lifespan. And this is the first study to our knowledge about the specific experiences of these families raising children with disabilities and their perceptions of the expanded child tax credit. So the findings that we described to you today and that we show in the report and the summary brief indicate that families raising children with disabilities use the financial support from the child tax credit in ways that were both similar and different to families that do not have children with disabilities. Even more so, we see that the use of the child tax credit among families raising children with disabilities was very consistent with what we already know about family financial hardship and what we already know about the pathways that these families experience. In particular, families raising children with disabilities appeared to use their child tax credit funds to directly respond to the specific ways that they experience financial hardship in terms of paying for routine expenses for their children, paying for medical costs, and through buffering loss of employment income that they may be experiencing, either through the COVID-19 pandemic or through their general experience caring for their children. We found that the CTC was utilized differently as well among families raising children with disabilities of different race, ethnicities, and also income levels. With non-white families paying down debt and investing in their children's education, as Laura talked about, and low-income families prioritizing meeting basic needs and spending more time with their children. We think these findings provide important contributions to the ongoing national discussion on the child tax credit. Existing work on the child tax credit, as we said, has not examined the use or impact of the funds on families raising disabilities, despite the fact that they constitute about 20% of children in the United States. As policymakers debate the future of the expanded child tax credit, the unique experiences and needs of these families are critical to consider. And these results are an essential and critical part of the conversation about the future of the child tax credit. So with that, we'd love to open it up for questions and discussion. Feel free to type any questions you have in the Q&A function or in the chat. I did want to notice, I noticed that Barbara Falkman, you had your hand raised. Let me know if there's if you would like to say something live. So we have a question from Chris. Thank you so much, Chris, asking if there were any unexpected findings. Laura, I just saw you take yourself off mute. Would you like to take us a chance on that?
Yeah, I can. So one thing that I thought was one of our findings found that and I think I reported it in here, but that the families raising children with disabilities were a smaller share of them reported spending on healthcare needs in one of the sets of findings. And you know, one of the things that we talked about in the report is that that perhaps that was due to families raising children with disabilities having a higher set of medical care needs that were kind of already set in place or that had already been budgeted for, where the CTC would not have offset those. But I know for me, that was something that at least at first was a little bit of a surprising finding, where I thought maybe that would have been used more for those needs. But it seems like maybe there were more pressing needs, such as those basic essential items, that were prioritized.
And I can jump in here as well. So hi folks, Stephen Roll. I'm an assistant professor of research at the Social Policy Institute and one of the researchers on this study. One of the things that really jumped out to me was actually about the differences between white and non-white families raising children with disabilities in terms of spending the CTC on tutoring or additional education for their children. So just to recap that result, 19% of non-white families raising children with disabilities reported using the CTC on tutoring for their children, whereas 0% of white families reported using the CTC for those purposes. And that's one of those results that was so surprising that I actually had us check it multiple times, because you so rarely see 0% of anything come through in survey research. And I found that very striking. And I think it is a function too of what we've seen elsewhere in the survey, that white families were often typically using the CTC for either longer term savings, or sort of like these higher order, less like subsistence level types of investments, as well as you can see on in this survey, more likely to use it for things like gifts for their families or entertainment for their children. But I found this result very interesting because it speaks to, I think, the ability for unconditional cash transfers like the CTC or other similar programs to help address educational or care disparities and care inequities that we actually see in society. We know that white families in general, as well as potentially white families raising children with disabilities, have more access to extracurricular educational resources and things like that than non-white families. So the fact that these families, so non-white families raising children with disabilities, were using the CTC funds, yes, to take care of essentials, but also to get their children access to extra educational resources, I thought was very encouraging. It also follows a similar pattern that we saw in the more general sample of CTC recipients. So any CTC eligible family, not just those raising children with disabilities, where we saw that Black and Hispanic families were also more likely to use the CTC for tutoring and extracurriculars for their children. So again, speaking to the fact that these unconditional cash transfers can help, I think, rectify some of these fundamental educational and care-related disparities that we see in society.
I'll add just one more thing. I think the employment effects in this study were pretty interesting and complex. So in our broader study, and then there's actually quite a bit of academic and policy hand-wringing over whether or not the CTC would affect employment, and the vast majority of the studies have found little to no effect on employment for families receiving this child tax credit. What we found was interesting is that the relationship between employment and parents of children with special healthcare needs was a little bit more complex, especially in our study. And I think that this population is just a really important example of why work requirements and income requirements can be counterproductive, because there are so many families with complex needs that might prevent them from working, or for maybe families in this study, because their children need such intensive care, it actually, might be more, it might be cheaper to stay home with those children than it would be to pay for the complex care that they need. So I think this is a really great illustration of why we need to put the choice of employment decisions in the hands of families, and also to reiterate again and again that care work is work.
Absolutely. Thank you so much for those thoughtful responses. Barbara Falkman, there are a couple of other questions in the Q&A, but I see your hand, so I'm going to unmute you. So you're unmuted if you'd like to speak.
Thank you very much. That was an error on my part. I apologize.
Oh, no worries. Okay, so another question we have in the Q&A asks about, from Meredith, did any of the families share about, have an opportunity to share any of their experiences with policymakers so far that you are aware of, and how did policymakers respond to hearing about those experiences?
So there is a larger coalition, I think many of the people on this call are in it, called the Automatic Benefits for Children Coalition, who is has been working really hard to make sure that families impacted by the CTC or potentially impacted by the CTC, their voices are being heard in Congress. And, you know, we are supportive of that work. We have not specifically connected our survey families with representatives, although we, of course, have shared our findings with White House staffers and congressional staffers and Senate staffers. And I think that though there's been a lot of bipartisan support, in case anyone was not following this with bated breath at the end of 2021, we were very close to expanding, making the expansion permanent. We were one vote away from making the expansion permanent, but President Biden has made a permanent expansion a top priority. So it's possible that we'll see some movement on that in the next couple of years.
Thank you so much. Another question from Isabel asking if there's anything in the survey or anything in your conversation with families that spoke to their experience with tax filing. We know that a lot of families were not connected to the IRS, and so they actually had to file with the IRS in order to receive this tax credit benefit. And that was another sort of interesting thing that happened when this was rolling out for families in 2021. So any experience with hearing from families about the tax filing experience?
So we don't have data specifically on folks' tax filing experiences, and it's a wonderful question, by the way. I want to first acknowledge that this is a great question. We didn't collect data specifically on their tax filing experiences, just whether or not they had filed their taxes. But it's a question that touches on this really interesting sort of dynamic in terms of maximizing take-up, which is, on the one hand, administering things like the CTC and the EITC through the tax code makes it very automatic and very simple for people that file their taxes, which is the majority of people, but does tend to exclude those that don't file their taxes for some reason. Either they're elderly and aren't under any sort of requirements to, or their incomes don't fall above a threshold to where they need to file their taxes. And sometimes these folks are the most marginalized people in society. So there's still this pretty important gap in getting universal coverage with social welfare programs administered through the tax system like the CTC and the EITC. Now, encouragingly, and I just looked up these estimates just to make sure they were up to date. So the IRS announced that about 88% of eligible families received the CTC, and our own work indicates that families raising children with disabilities were actually more likely to receive the CTC than families not raising children with disabilities. So, those are very high numbers, and they're very high. They're higher numbers than you'd see if you tried to administer this program, say, outside the tax system. That you'd probably see numbers more like SNAP take-up or TANF take-up, which are much lower. So in the end, that's encouraging, and it was also encouraging that there was this great groundswell of movements, advocacy organizations, grassroots organizations, technology firms that were designing tools and outreach approaches to try to get as many people to either file their taxes or using the IRS non-filer tool as possible. And I think the fact that we're seeing nearly 90% take up of this credit, which is higher even than the EITC, which has been around for decades, is indicating that those approaches were very effective.
Thank you so much. Another question from the Q&A. Please do feel free to ask more questions in the Q&A or the chat box. Veronica's asking if there was any data that is broken down by the age of children, which doesn't sound like you collected that data on the survey, but interesting to think about or to ask nonetheless.
So it's a challenge in the survey. we actually collected the age of what we call the reference child. And I'll get a little into the weeds before pulling back again. So to minimize respondent burden, we randomly selected a child in the household to ask about. So randomly selected your oldest child, your second oldest child, and so on. Then subsequently in the survey, we later asked, does anyone in your household have a disability? We defined disability, and then asked whether it was the adult or the child in the household who had a disability. Now, the advantage of that approach is that we get a household level measure of whether or not there's a child in the household with a disability. The disadvantage of that approach, and one that we would probably rectify in retrospect, is that we actually don't know which child in the household has a disability. We don't know the characteristics of that child specifically. We know the characteristics of the family, but not of the child specifically. So unfortunately, we cannot answer that question.
Thanks, Dr. Roll. I'll just add a bit of commentary from my role at the Catalyst Center. We've been following this for some time and encouraging our connection with state maternal child health programs and their partners as well to really think about the potential for the expanded child tax credit, as a way to support families raising children with disabilities. And your survey was and still is the only survey so far that it even had data where we could take a look at those families. So even though there are these limitations, I'm so grateful that you asked that question so we could see some data about these families in particular. So another question from the Q&A box asking about the breakdown by number of children in the household, which we do have. So I'll go over to that slide, but also thinking about if spending and use of the child tax credit might have differed based on the number of children in the household. So any comments about that? Thoughts about that?
My primary thought is it's a great question. We wanted to be selective about the subgroups that we investigated here, which is why we focused on low-income households and sort of these racial and ethnic minority households. We do have the data on the number of children in the household, but transparently have not looked at it through this lens. I think we'd be happy to pull some information on that for you if that is of interest. I think it'd be very simple to pull those numbers. Yeah, I wonder if there are any other thoughts, considering that this was a credit that families received for each child, whether it wasn't a credit that had to go farther if the number of children was more. It was a credit that was attached to each individual child. So that would be a sort of, I think, interesting data to look at. Another question from the Q&A, if you have any information about for families in the comparison group who didn't receive, or families in general who didn't receive the child tax credit, what were the reasons that they did not receive it? Happy to take this one as well. So the first thing to note is the comparisons that we presented on were among CTC eligible households. So the primary sort of axis of comparison here is CTC eligible households raising children with disabilities versus CTC eligible households raising children without disabilities. But to answer the question directly, for the more general study where we did leverage this comparison group more fully, the comparison group was comprised of either families without children in the household, families not raising dependent with children, but who were not tax dependent children, or families with children above the age of 18 in the household. So those three groups comprised our comparison sample.
Thank you. And I just want to open it up if anyone has information. I know that many of you attending the webinar today sort of have some information about potential reasons that families that were eligible to receive the CTC maybe did not receive it. And administrative reasons or other reasons. I know there were anecdotally, I've heard of people that were very concerned that that money would have to be paid back. And so they were pretty skeptical about it and chose not to maybe do that. Is a reason that I've heard as well. So if you have information about that, please feel free to, and you're attending, please feel free to put that in the Q&A or the chat box.
So our larger study did address this for families who should have been eligible but didn't receive it. We did ask that. I'm going to drop that answer in the chat directly from our report, but basically the most common reason that families didn't receive it is that they had opted out. So families could opt out of the monthly payments to receive it at tax time. If they were, a lot of people, because this was a new policy, they were afraid that it would increase their tax liability at tax time. But then other people just simply didn't know how to receive it. And I think there's been a lot of work by other groups finding that, especially families, maybe families, low-income families or immigrant families, just did not have enough information to access the credit, which would need to be remedied if the expansion were made permanent.
I noticed someone who's attending, Dana Logston, has her hand raised or their hand raised. Dana, I'm going to unmute you if you'd like to speak, or maybe did that go away? Sorry. Okay, looks like it went away. Any other comments for the tax or for the Q&A or chat for the Q&A? I wonder if I could sort of, as we wrap up, and we invite you to connect with us, either any of us at the Catalyst Center, the Social Policy Institute, again at Washington University in St. Louis, the Family Economic Policy Lab at Appalachian State University. I wonder if I could ask our colleagues at SPI and the Family Economic Policy Lab to talk a little bit about what they think is next for the CTC. And if you know anything about what's happening at the state level. I understand there are some states that are have offered child tax credits in the past or are thinking about doing so and trying to fill some gaps that way. What do you think is on the horizon?
I feel like we should ask Meredith to jump in on this one. I know the DC Coalition has been really active. Like I said, so the President Biden has put a high priority on making the extension permanent. A lot of people, Congress people have been working on this, on making the expansion permanent. So, and there are quite a lot of academics working on digging into things that what happened during those 6 months and immediately after. Folks at Columbia have been working really hard on this, and other groups. So there's more data coming out about employment effects, about poverty effects that will hopefully inform a national conversation. Stephen, do you want to add anything to that?
No, I think that's a very good synopsis, Leah. The only thing that I would say in addition is there is a lot of debate over what form the future child tax credit will ultimately take. The structure of the 2021 expansion was quite unique from sort of a US policy perspective, in that it was nearly universal and didn't have any work requirements. And fortunately or unfortunately, those elements appear to be among the biggest sticking points. the bill's opponents. So even though there appears to be at least a majority agreeing that some form of the child tax credit is valuable as a policy, I do think that ultimately there's going to be a lot of debate over the extent to which these credits should be targeted and should only apply to those who have some amount of earned income throughout the year.
Thank you so much. I'll say again that I really appreciate the partnership of Social Policy Institute and the Family Economic Policy Lab in accessing the data and helping to analyze the data so we could put together this research report and summarize it in the brief. Speaking for myself, given that the population of families raising children with disabilities is a substantial proportion of families that are raising kids in the U.S. I really do hope that the advocacy groups that are focused on families raising disabilities at the national level, at the state level, at local levels, can really be seen as partner advocates to national and local and state organizations that are focused on the child tax credit for all families. Because as we've seen, some of the benefits are the same, but some of the benefits for families raising children with disabilities are unique to them and really seem to help with specific ways that these families experience financial hardship. So I want to acknowledge and thank all of the presenters here today, as well as the report authors, including our leader at the Catalyst Center, Meg Camo, our grad assistant at the Catalyst Center, Candace Jarzambek, and others as well. Thank you so much for joining today. I don't see any other questions in the Q&A, so we can adjourn. Thank you all again for joining. There is a post-webinar survey, and I thank you in advance for completing that. It will pop up directly after the webinar closes. Your feedback means a great deal to us. If you're not able to complete the survey now, you'll also receive a link in a follow-up email to complete it. You can visit our website, catalystctr.org, to access the recording and the slides and additional resources related to children with special healthcare needs and children with disabilities. Thank you so much again for coming, and have a wonderful day.